Today's topic of interest is fluorides in dentistry. We'll be looking into the content of this presentation would be largely focusing on the introduction to fluorides. Okay, what is the significance of these fluorides in dentistry? Okay, how the evolution of this fluoride came into dentistry. What is the uh, effects of fluorides on the dental tissues, or how does it prevent? Okay, as you all know, fluoride is effective in preventing dental caries. Okay, how these things came into picture, so that is what we'll be dealing in this session. So as you all know, uh, in the table, okay, of we know that the relative atomic weight of fluorine, I'm not saying it's a fluoride, it's a fluorine. Okay, its relative atomic weight is 90 and atomic number is 9. Just as like any other trace elements which are found in the human body, just like calcium, magnesium, or anything, fluorine also plays an important role. Okay, which is the most electronegative and reactive of all elements, which is rarely found in its elemental state also. However, the Federal Register of United States of Food and Drug Administration describes these fluoride as an essential element, just as I had earlier mentioned, like a calcium, magnesium, whatever it is. Okay, it is also an important element which is useful for bone formation, okay, or bone maturation to be specific, okay, just like calcium and all. Okay, but I would say that fluoride is a double-edged sword. Okay, it can, it is also having good effects and also bad effects. Let's look into the picture. Okay, the WHO expert committee says it is one of the physiologically essential trace element. How? Let's look into the history of it. Okay, basically how it is present. This fluoride. Okay, it is this fluorine is seen as a combined form, which represents almost like 0.06 to 0.09 percentage of the earth crust. It is mostly found in rocks and soils, and it's also present in other combined form with other minerals like fluorospar, fluoroapatite, cryolite. Mostly, it is seen in volcanic erupted areas. Okay, these are all the just geographical forms, but these forms can't be used directly in or in humans. The history of fluoridation. Okay, what is the significance of this fluoride? Okay, in human physiology starts from the 1901 when Dr. Frederick Mackay in Colorado Springs in USA noticed that the people, okay, among the permanent residents of that Colorado Spring area, okay, they found that he found that they were having the stains which were called as Colorado stains, okay, and Mackay called it as mottled enamel. Okay, these were the clinical clinically seen enamel model. Okay, he described this as a minute white fleck or yellow or brown spots or areas scattered irregularly or streaked over a tooth surface, or the entire tooth surface, which looks like a dead paper, white like color of a china dish. Okay, that is why he mentioned it as a mottled enamel. Okay, in 1901, Frederick Mackay. Okay, this is the white fleck you can see. Okay, so these are the severe forms of starting from the picture A till picture F. Okay, you can see the severe forms of fluorosis, which he initially mentioned it as enamel mottling. Okay, these were only restricted to those people who were seen among the Colorado Spring area in USA. And these were the pioneers. Okay, to just give a brief introduction. Towards the left, you can see Frederick Mackay. Okay, and there's an older picture holding a glass of water. Okay, experimenting on fluoridated water. And next, you can see GB Black. Okay, you would have known about him, would have studied about him. The GB Black's classification for dental grade is class 1, class 2, everything. Okay, and later on, his Frederick Mackay's work, okay, after the late Mackay, Trendley HD was the pioneer, okay, who came up with this fluoridation, that is water fluoridation, and he came up with the set of principles it put forth that fluoride is effective in preventing dental caries. Let's look into the history. In 1905, okay, after naming in 1901, after observing this enamel mottling, 1905, Frederick Mackay moved to St. Louis for his higher studies. Is moved to St. Louis and stayed there for almost 3 years. And after 3 years, in 1908, he returned back to Colorado. Whereas in case of 1905, okay, he didn't find any, in this past 3 years, he didn't find any enamel mottling or any kind of clinical scenarios or clinical cases with these kind of states. But once he finished his years of experience or getting trained in St. Louis, he moved back to Colorado in 1908. In 1908 May, okay, he presented, okay, to his astonishment, he also saw the worst case scenario of that is a severe enamel mottling. Okay, so he presented on May to El Paso County Odontological Society about this enamel mottling. And in 1908 June, okay, he presented to the State Dental Association in Boulder with the help of a patient. He exhibited the patient with this Colorado stains, where GB Black was also present in that society. Okay, so GB Black also followed him. So he said he needed the help from a recognized research worker. So he approached GB Black. Later on, McKay and Isaac Broughton and A. Fleming examined 2,945 children in the Colorado public schools. And astonishingly, they found that 87.5% of the children were affected by this kind of enamel mottling. 1909, okay, the State Dental Association, okay, with the help of Dr. G.V. Black, described the histological examination of this lesion. This is the picture how where you can find G.V. Black and Frederick McKay examining a child in the Colorado Spring area. Okay. Later on, G.V. Black, with the help of G.V. Black and Frederick McKay, came up with this histological finding: the endemic imperfection of an enamel of the teeth, herefore unknown in the literature of dentistry. In 1912, McKay found an article by Dr. J. M. Eager, which was published in 1902, reporting this unusual occurrence of a brownish stain at Naples, which described a which was described as denti di char. Okay, the denti di char means it's nothing but a dental tissue which was looking similar like a china dish. Okay, so he got the help of he sourced to the article, and then in 1960, McKay and Dr. G.V. Black, okay, they observed that 26 different communities from the various parts of USA had this similar kind of stains. However, the severity differed from place to place. Britain, okay, those born after 1898 showed enamel mottling, whereas in case of a bauxite, children born after 1909 showed enamel mottling. These were largely focused on the consumption of the water, which was which were not having any community water supply. In 1931, the element fluoride was identified as a mysterious factor causing this enamel mottling. In 1931, the US Public Health Services appointed Dr. Tenley H. Dean to continue the work of Frederick McKay. After the late McKay, Dean surveyed among 22 cities in the 10 states of USA, which accounted to almost like 5,824 children. Okay, in 1931, Trentley HD in this 21 city study found that the age group of 12 to 14 years were having more of this kind of stains, where the water fluoride levels range from 0.2 to 1.3 milligrams per liter, and found that the caries experience also dropped sharply towards 1 to 1.2 and then tend to level out. This 1 to 1.2 is nothing but the dental caries experienced by the children of 12 to 14 years. And the relation between the dental caries and the dental fluorosis, okay, from these city studies were tabulated. And they found that, okay, wherever the dental fluorosis had a high amount, okay, where the fluoride content, the drinking water was found to be higher, there dental caries was found to be less. So the relation between the mean dental caries experience and the prevalence of dental fluorosis among the children of 12 to 14 in 9 of the 21 cities with water fluoridation concentration from 0.2 to 1.3 milligrams per liter. So this questionable diagnosis were put forth wherever the concentration of fluoride in the drinking water increased, okay, there and all the DMFT value comparatively less. So you can see here, okay, the darker one is the dental caries experience, whereas the white is the fluorosis, the percentage of fluorosis. So you can see the darker one as the dental caries experience reduces, okay, the fluoride content also increases. Okay, then he put forth this thing as principles. Friendly has been came up with the principles that the higher concentration of fluoride in the water is directly related to the severity of enamel mottling. Okay, so he had found the association, however, he could find the causative factor. He couldn't like clear cut say the causative factor what had prevented dental caries. Later on, enamel mottling is widespread in areas with water having fluoride content of 3 ppm. And mottling with discrete pitting of enamel was noticed at fluoride levels of 4 ppm. Mottling was less in case of fluoride levels of 2.5 to 3 ppm with a dull chalky white appearance. There was no mottling or any other enamel changes were observed in areas with water containing 1 ppm of fluoride. So these were all the observations which were reported by Trundley HD. 1934, coming back to the history, 1934 Dean developed a standard system of classification of dental fluorosis, that is the mottling index, which later on was called as the Dean's fluorosis index. In 1942, Dean observed that 1 ppm of fluoride content in the drinking water subsequently reduced 60% of dental caries experience. In 1945, the first artificial fluoridation was established in USA. And also subsequently in 1969, the WHO advocated that 1 ppm of fluoride in the community water supply was a practical and effective means of public health measure in preventing dental caries. So these were all the criteria which was put forth by Trundley HD in 1934. A normal tooth to severe form of dental fluorosis using 6 to 7 criteria. Okay, normal, questionable, very mild, mild, moderate, and moderately severe, and severe form of dental fluorosis were included in his initial index. The beginning of water fluoridation started in the year 1945 on January 25th. The Grand Rapids became the first city in the world to add the fluoride in its public water supply. The city, along with the US Public Health Services, the Michigan Department of Health, and the University of Michigan School of Dentistry, began a 10-year study to determine the effectiveness of fluoride in the prevention of tooth decay. The city was chosen as a test site because of its large population of school-age children, its closeness to Lake Michigan, which is mostly free of natural fluoride, and its proximity to Muskie, which serves as a control city also. By 1955, the study results showed that 65% reduction in tooth decay and led to the adoption of fluoridation as an acceptable public health measure. So, with this, we with this 21 city studies, still that this 21 city studies, it was just an observational study. There was no experimental. There was no community water fluoridation done. It was just an observational study. Only after 1945, on January 25th, only this water fluoridation, that is the community water supply of that area of the were given with 1 ppm of fluoride and found that in 1955 65% reduction of tooth decay was seen, and this led to further carry out different studies in different parts of the world, and this was the pioneer study which led to the fluoridation. However, this fluoridation is also having a negative effect also. As I had earlier said, the higher the concentration can lead to dental fluorosis. Okay, not only dental fluorosis, skeletal fluorosis also. Okay, which we will be looking into in the forthcoming sessions. To finally say, fluoride is a double-edged sword. As I had earlier said, higher the concentration of fluoride in drinking water would lead to dental fluorosis, but the optimal level would prevent. The reduced level also will cause dental caries also. So optimal level of fluoride should be maintained in the community water supply. However, different schools of thought had led to adopt, many states had adopted this water fluoridation. However, in India, okay, we are not following any water fluoridation. Wherever, however, there are very few states in India, okay, which has this higher concentration of fluoride in the drinking water, which had led to defluoridation also, and also the serving with community water supply. So that is the final quote that I would say. Fluoride is a double-edged sword. With this, I would like to end my presentation. Thank you for your patient hearing, and you can look for the references for the chapters for further reading from Fluorides in Caries Prevention by J.J. Murray et al., Fluorides in Dentistry by Francesco, and Fluorides and Dental Caries, a Compodium by Ved Prakash J. and Amrit. Thank you. Thank you for patient hearing.